Welcome to Hello Doctor Talks. Today we are going to discuss about gynecological cancers. To discuss more on this, today with us Dr. Vijay Karan Reddy. Dr. P. Vijay Karan Reddy, consultant clinical oncologist, practices and treats all cancers with radiation and chemotherapy. His specialty is in treating brain tumors, head and neck cancers, pediatric cancers, gynec cancers, and also trained in advanced radiation technologies, including proton therapy. Doctor, what are the common gynecological cancers?
Gynecological cancers include cancer arising from any of the female reproductive organs. That could be the endometrium, that is the uterus, ovaries, cervical cancer, vaginal cancer, and the vulval cancer. Out of these, cervical cancer and endometrial cancers are the most common. Cervical cancer incidence has been incidentally falling for the last 5 to 10 years. However, endometrial cancer incidence has been growing. The other cancers, ovarian cancer, vaginal cancer, vulval cancer, are much less common.
Doctor, what are the signs and symptoms of gynecological cancers?
For any cancer, the symptoms depend on the site of the cancer. So for cervical cancer, the most common symptom is pervaginal discharge or bleeding. For endometrial cancer, it is postmenopausal bleeding or postmenopausal spotting that can happen. Apart from this, a little advanced disease can cause back pain, bone pain, pain during sexual intercourse, change in bowel and urinary habits.
Doctor, what is the cause of cervical cancer?
Cervical cancer is one of the most common cancers, and more than 95% of cervical cancers are caused by HPV infection. HPV is human papillomavirus, just like our COVID virus is another type of virus which causes cervical infection. This persistent infection can eventually turn into cancer. Almost all women have HPV infection, but it is usually taken care by immunity. If it is persistent and recurrent over a period of 20 to 25 years, it can turn into cancer.
Doctor, how do we prevent cervical cancer?
So any prevention can be done in two ways. One is either vaccination or screening. For cervical cancer, screening is done with the help of pap smear. Pap smear is to be done by every woman whenever they go to a gynecologist for a checkup. There is no high-risk individual for a pap smear. It is a very simple, cost-effective, non-painful procedure where a cotton swab is taken and tissue from the cervix is collected and seen under a microscope. A pap smear once a year is good enough. For younger females, once every 2 years. If 2 consecutive pap smears are negative, then you can stop doing it. Apart from the screening, the next way to prevent cervical cancer is by HPV vaccination. So this vaccination should be given to girls and women starting at the age of 19, going up to the age of 27 years. It can be given in either 2 doses or 3 doses, 3 to 6 months apart. And this vaccination is easily available in any of the medical shops.
Doctor, what is pap smear?
So pap smear is basically collecting tissue from your cervix. When the gynecologist is examining your cervix and your vagina, they'll take a small cotton swab and run it over the cervical lips and the surface of the cervix. These cells are seen under a microscope to see if there are any abnormal changes that are happening on the cervix. And that it will also help you try to catch cancer, pre-existing cancer or cancer developing in your cervix.
Doctor, is cervical cancer curable? And what are the treatment options available for it?
As much as the cervical cancer is very, very common, the good thing is that it is one of the most highly curable cancers. The chance of cure is more than 90% when it is caught in early stages. The treatment available for cervical cancer could be anything. For any cancer, it is either radiation, surgery, or chemotherapy. In cervical cancer, early stages, radiation and surgery can take care of the cancer. If you come to a little later stages, radiation along with chemotherapy will help you cure cancer.
Doctor, how do we detect cancer of uterus?
So unlike cervical cancer, unfortunately, there is no screening for uterine cancer. Unless the patient shows any symptoms, we cannot actually detect. But the most common symptom, because postmenopausal bleeding is the most common symptom, when that happens, please go get it checked with a gynecologist. She will do a endometrial biopsy or a curettage to collect some cells from the lining of the endometrium. And then if there are any cancerous changes are there, then we can treat it accordingly.
Doctor, what is the cure rate and treatment options for uterus cancer?
So compared to cervical cancer, the cure rate of uterine cancer is little less, 85 to 90%. But at the same time, that also depends on the stage that it is detected in. Early stage have 90+ chance of cure. In endometrial cancer, the mainstay of treatment is surgery. So as soon as your gynecologist picks up any abnormal cells from the lining of the endometrium, the first and foremost thing that you need to do is undergo surgery.
Doctor, how do we detect cancer of ovary?
Unfortunately, unlike cervical and endometrial cancers, the symptoms of ovarian cancer don't show very early. It is usually bloating of the abdomen or change in bowel and bladder habits. Because of this, ovarian cancer is usually detected in much later stages. The only way to detect ovarian cancer is either do an ultrasound of the abdomen, or you can do a blood test called serum CA-125, which is a tumor marker. It is usually elevated when there is cancer of the ovaries.
Doctor, what are the treatment options for treatment of ovarian cancer?
So for ovarian cancer, like endometrial cancer, surgery is the most important mode of treatment. First and foremost, as soon as you get detected with ovarian cancer, you need to undergo surgery. And post-surgery, you will need chemotherapy. Chemotherapy is usually given in 4 to 6 cycles, normally given 6 cycles, 3 weeks apart, and this itself will help you cure the disease.
Doctor, what are the side effects of chemotherapy?
So this is one of the very common questions a lot of people ask. Chemotherapy depends on the type of chemotherapy that we are giving and the type of cancer that we are treating. In gynecological cancers, the chemotherapy that we give are not as strong as that we give in breast cancer. So for gynecological cancer chemotherapy, the most common side effect would be hair fall. That is usually everybody they're usually worried about. But hair fall again is temporary. Once the chemotherapy is done, you will get back your hair. Apart from this, during chemotherapy, you will have change in taste, loss of appetite, maybe nausea, vomiting. But all of these can be easily taken care of by following the instructions of your oncologist and following a healthy diet and medicines.
Doctor, what are the side effects of radiation therapy?
So unlike chemotherapy, chemotherapy is given through your IV. So it is a systemic therapy. It will affect every cell in your body. That's why you have more side effects. But radiation is a local treatment like surgery. For gynecological cancers, we give radiation for cervical cancer and endometrial cancer mainly. During this, the area that is there, the cancer where it is and the area around it is only treated. Because of this, the side effects are very low, which include either loose motions or any change in urinary symptoms. But beyond that, there will not be any major side effects.
Doctor, what are the different types of surgeries for gynec cancers?
Technology in medicine, it has come a long way. So right from open surgery time, where the big incision had to be given over the stomach or the pelvis and then operated, from open surgeries we moved on to laparoscopic surgeries, where we just use a camera to visualize the area within the body to operate. And now we have robotic surgery. So the main difference between any of these surgeries, it is usually decided by the surgeon which is ideal for you. And the main difference is the amount of blood loss and the time of recovery. So if you do a robotic surgery, blood loss is very, very less and recovery is very, very faster, and it is much easier on the patient.
Doctor, what is the use of genetic testing for gynec cancers?
So genetic testing is usually very commonly heard of when you talk about breast cancer. But what everybody needs to understand is, along with breast cancer, uterine cancer and ovarian cancer also can be hereditary. There is a gene mutation called BRCA mutation, BRCA. So this gene testing can help you predict whether you have any risk of getting cancer in the future. But this gene testing is not done for all individuals. It is only done for people who have family history of cancer. That is either the mother or the aunt, the first generation or the second generation in your family have cancer, breast or ovarian cancer, you need to get your gene tested. This gene testing can be done either from the tumor once the cancer appears to know whether there is any germline testing in your family, or it can be done as a blood test. So a blood test in a family who has already had cancer will help you predict whether you have any risk of getting cancer or not.
Doctor, how do we prevent the recurrence of cancers?
So this is one of the very common questions that all our patients ask, that once the treatment is done, what do we do to make sure that the cancer doesn't come back? So whatever cure rates that we talk about cancer is when I say 90-95%, that means that less than 5% or 10%, there is a chance of the disease coming back. For you to prevent this, you need to go for regular health checkups, regular follow-up checkups with your oncologist as suggested. It is usually done once every 3 months for the first 2 years, then once every 6 months, and after 5 years, it is done once a year. Apart from this, you need to continue to follow a healthy lifestyle. Healthy lifestyle in the sense you need to exercise daily, Make sure that your diet contains more of fruits and vegetables and less of meat, less of processed foods, less of junk food. So a basic diet which is rich in fruits and vegetables with regular exercise, keeping away from smoking and alcohol can help you prevent the cancer from coming back.
Doctor, who will treat gynec cancers?
This is again a very important question. Like I said, gynecological cancers, especially uterine and ovary, the primary treatment is surgery. But in the present day, when there are surgical oncologists who are specialized in doing gynec surgeries, apart from a regular gynecologist, it is very important that you get the surgery done by an oncologist, because the extent of surgery without causing damage to the patient, to know the exact stage of the disease, it is very, very important for us to decide what the cure rate is and what treatment is best for you. So as much as a gynecologist will detect cancer, please make sure that you go to a oncologist for your surgery.
We have covered all the questions related to gynecological cancers. If you have still doubts, kindly mention in the comment box.